What if I only wanted to change my nasal tip and nostril? Would that be possible? Ethnic rhinoplasty is a well-known procedure which I'm performing for years. However, some of my patients are opting for more specific areas like tip of the nose and Alarplasty and nostril reduction. And they don't want a bridge augmentation and other parts of surgery, and mostly want a smaller tip and smaller nostrils from me. And most of the time they do this because they like their overall look and just want to focus on tip and the others. But sometimes actually the proportionally just the tip area is larger or nostrils are wider. When my patient wants this, it's important to know two things. First, in most cases, when there's a big tip skin, large tip skin, this skin must redrape in specific areas. In rhinoplasty, we cannot cut the tip from outside and give a shape. It's about what we do under the skin, and skin redrapes over it. So when there's a large skin, this skin must redrape forward projection or lower projection or rotation, and for the especially with the wide skin patients, this excess skin must redrape over the bridge part. So bridge augmentation helps this. It means if you want specific, like a really very tiny noses, as much as possible you need to do more redraping. So while you augment the bridge, some part of the tip skin redrapes over your bridge. So it's a benefit of augmentation.
Music licensing reimagined.
But still, without touching the bridge, you can have improvements. If your skin is not too wide, or if you don't want too much reduction, with just Tipplasty, you can achieve more refined tip. Of course, in cases that just small changes we want for tip of the nose, it's always possible to do. And for the nostril reduction, again, if you want to make not so dramatic changes, of course, it's possible to do nostril reduction with Alarplasty. When you rotate the tip without augmentation, it's going to be more pronounced. Maybe it's not going to look nice.
Music
So
licensing
you need to
reimagined.
focus on less projection or less rotation of the tip. So the achievements to have very small tip, it may not be possible. But some patients really don't want it. They want a moderate amount of reduction and shaping of the tip and some nostril reduction, which is giving really the actual changes. So Tipplasty and Alarplasty, just the lower part of the nose, is very good alternative for patients who are seeking this kind of treatment. And it's very popular these days. And also the healing time, of course, is faster when you compare to full ethnic rhinoplasty. Although we use some grafts, we need to use some grafts for Tipplasty, reshaping the tip.
Music licensing
Because we don't make so much dissection, we don't make bone cuts, of course healing will be faster. It's important to talk with your doctor, surgeon about these alternatives to achieve a change which you like to have. Thank you.